I'm Chris Sanchez. I'm the Director of Compliance and Clinical Development for Premier Health. I do all the regulatory, compliance, policy, procedure management. So what I'm going to do today is do just a brief regulatory overview of all the different components of our compliance and quality department. Urgent care is regulated by organizations the same as any other healthcare facility. We have OSHA, we have the CDC, we have corporate compliance. So for our regulatory standards, we try to maintain the highest standards company-wide. We follow CMS protocol, we follow all your OSHA protocols, federal state regulations. We have a compliance committee that's organized that takes care of many different components of compliance, and I'll go through some of these. We have our policies and procedures, we have corporate compliance law, HIPAA, everybody's familiar with HIPAA and privacy requirements. We have quality management, documentation standards, we do chart audits, billing audits. Our human resource department keeps up with licensures and employee file requirements. We have required education, employee rights, patient rights. We really stress confidentiality. We have technology that we add every day to our processes for operational efficiency. We have laboratory standards, code of conduct. Our management team is trained on a regular basis, and we do have specific state and federal regulations. One thing that I'm going to go through with the group is how to access our policies and procedures. Our policies and procedures are electronic. We don't keep paper copies in the clinics. I'm going to go through the clinic drive at the end of the overview to show you where to access your policies and procedures. Compliance, one of the main components is our code of conduct. You'll be issued a copy of the actual code of conduct on hire with your onboarding information. Your code of conduct is going to be your standards, our operational standards, our ethical standards, our business standards. You'll be required to actually read the code of conduct and sign a certification certifying that you read the code of conduct and that you understand it. Every year annually, you'll also have to redo that compliance certification. And that is a requirement of corporate law, and we do follow that. So normally what will happen is when your managers are doing your annual evaluation, they'll go through your compliance certification with you in case you have any questions. We also have a means for employees to report compliance and integrity problems. You'll see on your UltiPro news page, there's all your reporting mechanisms. You have access to email, you have access to fill out a form to turn in or email, or there's also a confidential compliance line if you want to report something confidentially. There is a no retaliation policy here. No employee will ever be reprimanded for reporting another employee or any type of compliance or integrity concern. There is a corrective action process. Any concern that you have, there's a very strenuous corrective action plan. There's an investigation procedure, and usually within 2 to 3 days your concern is addressed if not corrected. These are the different compliance mechanisms. These are posted in every break room as well as on your UltiPro news page, and you can also access these on the clinic drive. We do follow non-discrimination policies here. We do offer access to employees and patients, any type of barrier of communication. We have language access services. If a patient comes in and they speak a different language, we can provide them translator services real-time on the phone. Also, our patients can have translators on site. The nature of our business is a walk-in business. We don't take appointments, so if somebody does come in and they want a translator on site, we do have a guide that we have to tell them it may be 1 to 2 hours before we can have someone on site, but we can do immediate translations by phone. We also follow all ADA structural guidelines. We offer different languages, we have Braille, we have all the ADA requirements for handicapped accessible facilities. We do practice cultural diversity. You will actually get a training module on this through Litmus. We do cover a wide area. We do have a lot of cultural differences in our employees and our patients. Just always be mindful and respectful that your beliefs may not be the same as someone else's beliefs. Your idea of proper health care or follow through or how you are addressed in a facility is not going to be the same as somebody from another country. So just kind of keep that in mind and be respectful. And always remember, the patient is always correct. Okay, so be mindful of that. Just some different dimensions of diversity. People have different marital status, different background. different gender, race, age, sexual orientation, all these things you have to consider on a professional level and non-judgmental. Cultural competence, you'll actually go through this training with the litmus module. We want our employees to be aware of all these different areas that you need to be culturally competent in, and you need to know how to handle those situations. And the litmus training that you'll go through will actually test you at the end of it to make sure if you're in the situation that you know how to handle that situation. And then we have HIPAA. HIPAA is our privacy component of our business. We do follow the notice of privacy practices. When a patient walks into our facility, we'll have a notice of privacy posted at the front desk. We don't give out paper copies unless they're requested, but they are posted at the front desk. If a patient wants a paper copy of anything to take with them, our front desk is equipped to print those out and hand those to the patients. We do acknowledge protected health information, PHI. We can issue that at a clinical level. We do ask that our employees maintain confidentiality in their practice. It's a need to know, minimal PHI. In other words, if you're talking to a coworker in the break room and they say something about a patient, don't go look up that patient's chart. Our EMRs are time-stamped. Only people that should be accessing the patient chart are those employees that had direct access to the patient care or management for investigative or quality management type situations. All patients have the right to make specific requests about their PHI. We can disclose at a clinic level. We can disclose PHI without the patient's specific authorization for anything considered treatment, payment, or a healthcare operation. Years ago, you would have to have a patient-specific consent every time you released a medical record. Those laws changed in 2013. You don't have to have that specific consent every time. You do have to have them acknowledge the notice of privacy. When they acknowledge that they read that, they're given their consent for you to use their PHI for treatment, payment, and healthcare operations. You're also allowed to use their PHI covered under the notice of privacy for any law enforcement or legal request. A specific authorization would be required for your patients if it's something that's not actually stated in that notice of privacy. And those types of things, or if an insurance company or a liability carrier or an attorney for a subpoena request a medical record, you do have to have a specific authorization for that. We actually have a medical records department here in the administrative office, and those types of requests like that would go through our medical records department. Any other just basic request about treatment or healthcare operations can be released to the patients at the clinical level. They don't have to come through medical records. If you ever have a question or concern about releasing someone's PHI to them, you can always get one of those authorizations just to make yourself feel more comfortable, and we'll scan it into the record. Or if you have any questions, if you're just not real sure, if it's a legitimate request, you can have an authorization filled out. If a patient has a specific request, we're legally required to let them fill out a request form. Those requests would be things like if they think that the record we gave them is not correct, they have the right to amend their records, they have the right to request a restriction to their records. That's also a different document that would have to be filled out. They also have the right to ask us not to bill their insurance company if they want to pay for something privately. And those specific request forms are also going to be accessible by the front desk staff, right at the front desk, so the patient can request that. We're going to do a quick regulatory review of OSHA. OSHA is your Occupational Safety and Health. It's the organization that governs all of our safety practices that we do in healthcare. We have a lot of safe work practices that we implement here. We have an emergency preparedness plan that we do actually use. We have flooding, we have hurricanes, we have tornadoes. We do implement an emergency preparedness plan at the clinical level. We have an incident commander here at the main facility at the administrative office. You will also get very detailed training on this through Litmus. This is just going to be a quick overview just to let you know we do have those processes in place. We have a hotline, we use social media, we use many means to get information across in an emergency situation. We have a notification call tree that will actually be posted in the break room as well. So you'll know who to call. If you have a bomb threat and you don't know what to do, you can go look at your little emergency call tree and it'll give you a detailed instruction on who to call and when to call them. Any clinic closures or reopenings are determined by the administrative level, by the incident commander. That wouldn't be something that's decided on the clinical level. So if you're working in a clinic and there's a hurricane coming, you can't just decide to close it. That has to be decided on the administrative level. Any extreme circumstance that would prevent you from arriving to work at your scheduled time that would jeopardize your safety, you would need to notify your manager for that. We do also have emergency codes and alerts that we practice. We actually have a drill done by the site manager each month. We do fire drills, weather alert drills, missing person drills, security drills. All these different drills we'll do throughout the year. These are done by the site manager and they are logged, and we do test our employees on those drills. So do participate. We also have a pretty extensive fire safety plan. You'll also do a fire training program in Litmus, the training program as well. We do have fire prevention devices, suppression devices, fire extinguishers at all of our facilities. We also practice our hazardous energy control. We have biomedical equipment inspections of all of our medical equipment so that it's deemed safe for patient use. We also have a process in place for medical device reporting if there is a problem with any of our equipment. We have a hazard communication plan. It's basically used to be called the material safety data sheets. Now they're called safety data sheets. We actually don't have a paper binder for this because it would be about 800 pages thick. We actually use an online e-binder through our waste management program. Employees have full access to this, and I'll also show you how to get to that on the clinic drive. We do practice safe ergonomics. We do a training on body position, proper patient positioning, proper lifting to avoid employee injuries. We have extensive training on hire and then annually, and then also throughout the year on bloodborne pathogens and other potentially infectious material. We do screen our employees through human resources for tuberculosis with TB skin test and questionnaire. Even if you have a clerical position, you'll still have to do the annual questionnaire every year. We do have processes in place for infectious disease emergencies like Ebola. That does happen from time to time. We have processes in place. We have a specific plan with each state's Office of Public Health on who to call, who to contact. Your main thing that you need to remember as an urgent care facility is it's not our job to treat these patients. Our job is to recognize them, to stabilize them, and to transfer them. We do have pre-made infectious disease kits in the clinics to protect our employees in the incident somebody does walk in the door. We have specific processes in place for cleanliness, for infection control. We do practice no food or beverages in your patient care areas. That includes your front desk, that includes your nurse's station. You don't want to be eating or drinking when patients are walking through. You don't want to have a drink at the nurse's station and you come out of a patient's room and you pick your Coke up to drink it. We just practice that. That's something our managers are real strict about, and they will, reprimand you for having food or drinks in the clinical or patient areas. We do use only CDC and EPA approved cleaners. We have designated storage facilities for clean and dirty. We have a lot of compliance signage we post around the clinic, so it tells you, basically guides you through what's a clean area, what's a dirty area. And it's the same everywhere. What we do at one place, we do it all. You can work here, you can work in Puerto Rico, you can work in Indiana. All your compliance signage is going to be the same. You'll recognize it anywhere. We have hand sanitation stations throughout the clinics. We use the hand gel. We have hand washing stations. We supply all your personal protective equipment. If there's anything that you would have to purchase separately. We have detailed waste disposal programs for regulated waste, hazard material waste, pharmaceutical waste. All that will be covered in detail through your training program as well that you'll do online. We do have risk management. We do track patient and visitor injuries and incidents, and we do track employee injuries and incidents. We do have processes in place for management, investigation, and corrective action of those. Your main thing that you need to remember as an employee, any incident at all, if you trip and fall, if you have a needle stick, the first thing that you do is you fill out an incident report, you get an evaluation on site where you are, and you call HR, and they will direct you from there. There's specific procedures that are outlined step by step for you. You don't have to go, wonder what you're supposed to do. I'm going to show you where to find that folder, and it basically is a detailed instruction sheet of what you do and what order you do it in. Same thing for needle sticks. We don't want you to wait 3 days if you have an exposure to something. We want you to have your blood drawn on site. We want the initial evaluation on site. And that will be different for some facilities that federal regulations require that they do go off site for treatment.